immediate care of newborn the birth. So today we will learn modern, not Ayurveda. Ayurveda we have different acharyas, according to different acharya we have different vinyas. That we will learn in theory classes. But as it is clinical class, we will see immediate care, immediately after birth. Now think we are in a labor room and we are delivering the baby. Obviously, when we are delivering the baby, we need both gynecologist and pediatrician. Pediatrician, why? Because for this process, like immediately after birth, what our care we should take, that we have to do. So we want a pediatrician there to examine a baby whether baby is normal or not. So what are steps you will follow immediately after birth? We'll see. Now think, it's a labor table and we are delivering the baby. Immediately after baby coming out, what are steps we have to follow? I'll explain. Initially we need, actually tray also we need. Like this. So we need tray to take a baby and two cloths, linen cloths it should be. One should be covered with the tray. Tray should be covered with one linen cloth, so that obviously to avoid the injuries to a baby from tray, because baby will be very sensitive. I think immediately baby came out. What you will do? Obviously immediately you will take a cloth and will clean a baby, because it will be filled with amniotic fluid, other mucus, everything. Baby will be filled with full fluids. So immediately we should clean a baby in a tray, and we should place a baby in a tray. After taking a baby, we will clean a baby. First thing what you will do, you will clean airways. Which are two airways mainly? Mouth and nose. First which you will clean? Mouth. Why? Because if we clean first nose, baby will start to respire. Whatever amniotic fluid or mucus present in mouth, it will be aspirated, right? So first we should clean the mouth, because if we clean mouth, baby will not respire from mouth, right? So then we have to clean the nose. Now before they were using suctioning tube, everything, we have instruments in department, we will go through later in practical classes. But now as a hospital has many other facilities, through suctioning, they will do suctioning, they will clean the airway, and this should be done within 1 minute. Within 1 minute after birth, we should clean the airway, we should do suctioning, everything, mouth, air, nose, everything, and baby should start respiration. One thing, another thing, cardiovascular system. If immediately after birth baby starts the respiration, obviously cardiovascular system also will be normal. So within a minute, that is known as golden minute, within that first minute baby should be normal. Then baby will not go into any other complications, especially like hemorrhage to brain something. Because if baby didn't try within 1 minute, baby will go into cerebellum will go into hemorrhage, and baby will be further complicated to cerebral palsy or any other complications. So within 1 minute we will do this, we will do suctioning everything. After suctioning, next step is, now baby came out. You cleaned the baby, you did suctioning, baby starts respiration. Next step is, something will be attached. Umbilical cord. Umbilical cord cutting is next step. Immediately after coming out, baby should respire, and cardiovascular should be normal within a minute. After that, baby is normal, we will go for umbilical cord cutting. How it should be done? Again, when we go for Ayurveda, according to Acharyas, different measurement we have. But as we are going to the modern, two stabs should be done. Like first stab should be from umbilical cord 5 centimeters distance first, and from that fifth one 2.5 centimeters or 1 centimeter approximately. Another one from, for example, now this is a cord. From here 2.5, one cord, one forceps, and beyond that 1 centimeter or 1.5 centimeter, another forceps. And in middle you should cut. Why 2 knots? Then we can do from umbilical cord 1 knot and we can cut, right? Why this? Because that umbilical cord, one it is attached to umbilical cord of a baby, umbilicals of the baby, and another one is for placenta, right? So through placenta also blood will be flowing. If you didn't clap there, that mother's placental blood, what it is coming, it will be flowing, right? So you should do 2 clamping and you should cut in the middle. According to Acharyas, again they inform that this thread should be tied to neck of a baby something. But in modern, now we will go for cord clamping. They will do cord clamping, and before shifting the baby to baby's bed or outside the labor room, we should see that whether cord clamp is correct or not, whether bleeding is happening or not. not, you should reassure and then you should move the baby. So immediately after birth, this we will do. After cord clamping, we will shift the baby to either radiant normal, or if baby is normal, we will hand over to guardian. Because mother will not be stable to hand over to mother, we will hand over the baby to guardian. But before, after this, when baby is normal, that too how? By after cleaning, you should cover a baby. Why you should cover a baby? Because womb temperature will be different, and what our environment temperature is there, it will be different. So initially, how you should cover the baby? To cover a baby also we have a procedure. It should cover whole body except face. Why? For respiration and eyes opening, everything. So you should initially cover a head because it is the main part to get hypothermia. So initially you should cover a cloth for head. You should cover extremities, and then you should cover a whole body. So this is the way we will cover a newborn to avoid not only immediately after birth, even later, after even bathing also, morning hours, after bathing, these all whole except face, everything should be covered. So by this initially, because now okay, we accept if we are in a labor room, we will be having radiator warmers, or like in NICU protocol we will be having, we can maintain a baby's temperature with radiant warmers. But before, obviously, as we know, before NICU and even most of the deliveries were happening in home only, right? So they were maintaining temperature of a baby like this by covering a whole body. This is first step. But before covering this cloth and maintaining, we have some examination of a newborn. Basically, the Ballard scoring, everything we will see in further topics, examination of newborn. But initially, Apgar scoring we have to do within 1 minute and 5th minute. If this 5th minute also, if we didn't get normal range of a baby, levels of a baby, then again in 10th minute, 15th minute, 20th minute we have. But initially, 1st minute and 5th minute we will see for Apgar scoring. Obviously, as we will be in hurry-burry in labor room, we will not see what is the AFP, everything. As their experience goes on, they will be continuously, they will be doing one of the other steps. But as we are learning, we should see what is that Apgar scoring. What is that Apgar scoring? A, B, G, A, R. And what is A? Appearance. How they leave about our classical thing, pediatric, we are studying everything, leave. Now immediately one baby is in front of you, which is born like exactly now, immediately baby is born. How the appearance will be? Appearance is nothing but color. Obviously, reddish pink or pinkish color will be. That is normal birth. We have 3 gradings in Apgar scoring: 0, 1, 2. If it is pink, 0, 1, 2, not 1, 2, 3. 0, 1, 2. If it is pink, 2. If it is pale or like light bluish or light pink, 1. If it is fully blue, 0. If it is blue, what it means? Sinus. Then P is pulse rate. What is the normal pulse rate? 120 plus or minus 20, or above 100. Above 100 is normal. But if it is below 100, then baby is going to distress its signs. So if it is above 100, how much? How much it may be means not above 160 also. 120 plus or minus 20 if it is, then baby is normal, we will give 2 gradings and we will move the baby. But if it is less than 100, then again we have to rule out. Or if we are not feeling pulsation only, then 0. It means baby is going into distress. Then G, Grames. What Grames is? That is reflex. For example, now within immediately after birth we are doing suctioning, right? If it is baby is normal, when we do suctioning, when we insert something pipe inside, what baby will do? Baby will start to sneeze, or baby will cry, baby will move the extremities, something activities, response, nothing but it will give, right? Though you are inserting any instruments inside or pipe inside, if baby is not reacting anything, obviously baby is not normal. So according to this, we will give the grading. If baby is not normal, not reacting anything, 0. If it is like activities, extremities are moving something, then 1. Or if baby is normal, like sneezing, starts crying, immediately after suctioning, clearing air, what baby should do? Baby will start to cry, right? That is normal. Then A, activity. How the normal baby's activity will be? Trying activities. Actioning, like moving the hands and legs, or flexing or extension, everything. Baby, especially babies, their hands and legs will not be like calm, right? Only during sleep their extremities will be calm, or else they will be continuously moving. So according to that, like if both, usually how the babies will sleep, if they sleeping also, hands will be like this and legs will be extended, right? This is normal. But if babies, one part is moving and one part is not moving, or upper part is moving, lower part is not moving, then one. If baby is not at all moving anything, obviously respiration, it means respiration is not there or you have some distress, then 0. Then next is R, respiration. What is normal respiration? Right? For newborns, 40 to 60. 40 to 60 is normal. If it is below 40 or nearer to 41, if it is respiration is very nil, then 0. So this is whole Apgar. That is APGAR. Whole this Apgar, obviously we have 0, 1, 2. So obviously 5. If we give for all 5 points 2 to 2, how much it will become? 10. So for including all these counts, if the readings comes 8 to 10, then baby is normal. We can shift to mother's room or routine case. But if it is 5 to 7, then baby is slightly distressed. We should give some extra care or extra treatment. If it is below 5, then baby will go into distress. We have to do block and we have to give treatment according to the complaints. So this within 1 minute we will do all those things. Baby's respiration and everything will be normal. First minute, after those first minute we will do the Apgar scoring, and in 5th minute we will do the Apgar scoring. If this first minute and 5th minute, if the ranges comes within 8 to 10 scoring, then we will shift the baby, no need to repeat again. If in 5th minute also it comes like mildly distressed or distressed, then again in 10th minute and 15th minute we will do. Again if we get less, then again in 20th minute we will do. If in 20th minute also if we get less than 7 or less than 5, then like 95% chances are there, baby may go into distress or cerebral class. If baby will go into cerebral palsy or any other complications, milestone complications, it's confirmed. See, at the time of birth only we will get to know within that 20 minutes whether baby is normal or baby will go into distress or baby will have any complications. We will get to know by this Apgar scoring. But here what the pediatricians will do, it may change or they may have some complications or they may not have, so they will not inform. Usually, if you see the cerebral palsy cases, they will not be knowing the baby is having cerebral palsy till the milestones they recognize that my baby is not sitting or not standing. Till they recognize, it will not be diagnosed. But we will get to know within this Apgar scoring 20 minutes. We will get to know, and we can advise the treatment according to this immediate care of the baby.